There is no COI in this study. Now, I would like to talk about a study in which intravesical administration of hydrogen peroxide to rats with pelvic vein congestion causes long-term bladder hypersensitivity with frequent urination. The etiology of chronic pelvic pain syndrome, including interstitial cystitis, bladder pain syndrome, seems to be multifactorial. Recent studies have shown that pelvic venous congestion is an important cause of chronic pelvic pain in humans and animal models. Recent another study reported that animals with an intravesical application of H2O2 exhibited bladder inflammation and hypersensitivity, which lasted longer than 7 days. In this study, we sought to establish a new model of longer-lasting bladder hypersensitivity induced by intravesical application of H2O2 using rats with pelvic congestion. Methods are shown in the slide. Bilateral common iliac veins and uterine veins were related. Vehicle or H2O2 solution was instilled into the bladder at 2 weeks post-pelvic congestion or sham surgery. Voiding behavior was evaluated using metabolic gauges, and cystometry was also performed at 2 weeks after vehicle or H2O2 application in each group. These graphs show the results of the number of micturition and average urine volume per voiding from pre-operation to 14 days after drug administration. Urinary frequency continued up to 14 days later in the H2O2 application with pelvic congestion group compared to the sham surgery groups. The table shows the results of metabolic gauge study. Pelvic congestion alone for 2 weeks did not alter these voiding parameters. However, the number of micturition of the CH group was significantly increased compared to the SB group at 2 weeks after drug application. The average urine volume per voiding of the CH group is significantly decreased compared to the SB or SH group at this point, respectively. These figures are representative CMG traces at 2 weeks after vehicle or H2O2 application. ICIs were significantly smaller in the CH group compared to the SB group. Basal pressure and peak pressure were not significantly different among groups. The bladder capacity of the CH group is significantly decreased compared to the SB group. In this study, bladder hypersensitivity evident as frequent urination with smaller voided volume lasted up to 14 days after a single intravesical application of H2O2 into rats with pelvic congestion, although pelvic congestion alone for 2 weeks did not alter bladder function. It is likely that two pathological changes due to chemical irritation and pelvic congestion act synergistically to induce a longer-lasting animal model of bladder hypersensitivity than previous models, including the H2O2-induced cystitis model. This study reveals that a single intravesical application of H2O2 into rats with pelvic congestion induces relatively long-lasting bladder hypersensitivity with frequent urination. Further studies are warranted to investigate the molecular or histological changes in relation to bladder dysfunction in this animal model. Thank you for your attention.